Welcome to Partners in Health and Biz with your host, Wendy Meyerhoff. Tune in every Saturday for great shows about obtaining and maintaining health, business, and finance. Learn from the experts here at PIHradio.net. And now, broadcasting from the Partners in Health and Biz studio, here's Wendy.
Hello, folks, and welcome back again to Partners in Health and Biz, and thanks to my colleague and founder of the show, Gail Dixon, for the intro. This is the business co-anchor, Wendy Meyerhoff, and this episode is about patient advocacy, which I call Learn About Listening. And to help me, I welcome Candace Wenham, and I hope I'm pronouncing that correctly. She'll get it right if I'm not. But Candace is from in Austin, Texas, and she's come to talk about patient advocacy, as I indicated with the show title, which is something both the health pros, and I know a lot of you are on my side, the biz side, but we also talk to the public, and patient advocacy is something both of those folks need to know about. Candace is a board-certified patient advocate, and she is CEO of Advocate ATX, all together, Advocate ATX, LLC in Texas. And before becoming a private patient advocate, Candace volunteered in hospitals. She's worked in home health care, and at one point she was also a professor of anatomy and physiology. So welcome aboard, Candace. Glad to have you on Partners in Health and Biz.
Thank you so much. I'm glad to be here.
All right, great. So, of course, the first question is the most obvious one. What is a patient advocate? Not everybody understands that yet.
So a patient advocate is actually not a medical professional. A patient advocate is providing education, supporting choices for the patient, providing an objective viewpoint, basically anything the patient needs regarding their healthcare choices. So a patient advocate is there mainly for education. So we're informational, we're not medical. And you'll see some patient advocates are nurses, some are even doctors. But when you're under the umbrella of a patient advocate, you're actually not providing medical services, you're providing informational services. We also help to keep patients safe, and that could be in the hospital. It could also be from, prescription side effects or interactions. We also help to alleviate stress and suffering. So a lot of people, when they call, they're actually under a lot of stress. That's usually the typical call, is that, they're having some issues, whether it's with prescriptions, whether it's with a diagnosis or treatment options. There's a big list of different things people call for, but a lot of times they are under a lot of stress. And we like to uphold patient rights as well. So we'll go through those patient rights in a little while, but some of those would include things like informed consent, the right to privacy, things like that.
Okay, all right. And so when did you become officially a patient advocate, and why did you decide to become one?
So I actually took an exam, a national certification. So I became a board-certified patient advocate actually in September of 2018. I decided to become one actually over the past, maybe 10 years or so, due to quite a few reasons, both for myself and from friends and family members. My favorite story is actually from my best friend. My best friend actually
Where? Your
diagnosed.
Best friend?
Yes. She actually was diagnosed with cancer. This was a few years ago, and prior to the diagnosis of cancer, they found something next to her liver, and this was a tumor. And they had gone through the scans, gone through different things. They didn't know exactly what was going on, so she told me it was cancer. So I decided, hey, you need someone with you. Before I was a patient advocate, but I really wanted to be there with her because I felt like I knew a little more about it. And this is an educated person. She's a licensed professional counselor. She knows what she's talking about. She knows what she's doing. But as far as medical things go, she didn't really know the terminology and that kind of thing. So I went with her to her appointment. And the doctor went through what he needed to go through, but he kept calling her cancer a malignancy. So she, at the end of the appointment, asked him if they knew for sure that it was cancer. So this really bothered me. So what she was saying is she didn't understand what the word he was using was. She didn't understand what malignancy meant. And this is really common if you think about it. I mean, a lot of people don't know these terms. And so a lot of people, might really mistake malignancy for something else, like benign tumor. So at the end of the appointment, she was still wondering if she had cancer. So that was just one part of it. The rest of the story goes, this guy did not even tell her to get an oncologist, okay? So at the appointment, this is just a general surgeon. I sort of raised my hand and said, well, since it's cancer, don't we need an oncologist? And he said, oh, yeah, well, you can do that if you want. He didn't really even, tell her that's what she needed to do. So it was kind of like she was just up to her own devices. That was kind of the second part. The third part was, once she did get an oncologist, this guy was actually, after she had her surgery, he was kind of tracking, what was happening with her cancer, if it was coming back or not. And she was on some medications from a different doctor. Well, one of these medications was actually causing a problem. And the problem was that they were actually using what's called chromogranin as a tumor marker. So the tumor marker,
what? They were using
it's
what?
It's called chromogranin. So it's actually a protein. Chromogranin, yeah. So chromogranin is a protein that's expressed, and expressed by cancer cells, these particular type of cancer cells. She had a neuroendocrine tumor is what it's called. And this type of tumor will secrete this chromogranin, and so you can actually detect whether this tumor is growing back by measuring the amount of chromogranin being secreted. So they were measuring this as the months went on, and all of a sudden her chromogranin is going crazy. It's going up to 1,000, 2,000. The next week it would be down to 300. Well, she didn't show any signs of this tumor coming back. She had some signs before. She seemed healthy,
Let me
right?
interrupt you because we could take the whole half hour to describe your friend's issue. But so
Sure.
This inspired you to find out what was really going on, to get the doctors to talk to her
So the
straight.
end of the story, so the end of the story is the tumor marker was actually going up and down from one of her medications she was taking. So the doctor had no idea she was on this medication. The medication was causing the chromogranin to go up and down, and I found it. I told the oncologist. He was floored, and therefore he took her off the medicine. The tumor marker went down to nothing, and he didn't have to treat her for her cancer anymore because her cancer did not grow back. It was actually only showing that because of her medication. So in that case, she really did need a patient advocate. So, this is one example of 100.
Even when you're well educated, and I've been a health writer for more than 20-something years, and I know that when it's someone I love dearly, even I can get confused, my brain.
Right.
And if I brought a list with me of the 20 questions I should remember to ask, that would be great. But it can be very difficult. Doctors have noted that they have this problem. So it's always good when you have, especially if they're totally outside. You were helping a friend, but if someone's totally objective and can look at both sides or all sides, because it can be the patient and the main doctor and then the specialist and then a nurse and Lord knows who else gets brought into this. So that's great about being a patient advocate. And it even brings in the question, so how does a patient advocate coordinate care for the patient?
So coordinating care is sort of, a lot of us have several doctors, right? And a lot of us actually take more than one prescription prescribed by different doctors, right? So every time you go to the doctor, you have to fill out a sheet that says which prescriptions you're taking or not taking. And I know just for myself, every time I go to my doctor, one of my doctors, I'll fill out this form, and every time the medications are incorrect. It's just, we have electronic documents, but those electronic documents do not go from doctor to doctor. They just go between the place that you fill them out.
Yeah, unless you're with the VA or
right.
I know from my work with Kaiser. I've been a Kaiser member for, I think, 3 years now. And
nice.
Those folks have complete computer systems that integrate. So Dr. A knows what Dr. B is prescribed, and the physical therapist knows. And if it does have to go outside, they give you good printouts of things to take with you.
Right. Yeah, so, there's some places where it is coordinated, but let's say, for instance, you're getting out of the hospital and you need care, at home. So a patient advocate might, coordinate that care. So maybe it's hospice you need, or palliative care, or home health. Well, let's say, for instance, this patient needs a ventilator, and a lot of hospice will not take a ventilator. So this, a patient advocate would be able to find the hospice that would take a ventilator using, community resources that a family would not, possibly be able to find. You can call 100 places and not be able to find a hospice that takes a ventilator. So that's one sort of example. Also, finding transportation from the hospital. That's a way to coordinate care. Yeah. Also ordering medical equipment for the home health care. That's kind of a big deal. Also, making sure the insurance covers the medical equipment. Getting the prescriptions from the hospital to the home, getting those filled and covered by insurance. That can be a big issue. Also, you could have, a second opinion that might be needed. The patient advocate could coordinate that second opinion, pathology, things like that.
Okay, my God, and that's just a short checklist.
There's a lot
more to about, but let me just take a short break. I need to remind folks there's still time to be a guest or take an ad for 2019 Partners in Health and Biz. You can also get specialized audio segments once you're a guest from the show, specially crafted by my partner Gail Dixon. And you can get also marketing materials such as an ebook or blogs from me, Wendy Myeroff. And for more information, we'll tell you, of course, again later, but you can email me at wendyjm.pih@gmail.com. So here we are, back, talking to Candace Wenham, my guest, who's telling her experience as a patient advocate and what the rest of us also need to know. So you mentioned all this coordination, and you just gave us a few of them. Lord knows what else you have to figure out. How do the patient advocates help the doctors?
So that's a good one. Helping doctors is really just a huge part of what we do. And, it's one of those things where I'd really like to get that word out is we really can help doctors. Doctors don't have a lot of time to explain things to patients, and that's one of the big parts of patient advocacy is just explaining information to patients, whether it's diagnosis or, how to take their prescriptions correctly. We can take notes at appointments. We can ask questions.
I remember you just mentioned earlier the word malignancy.
Right.
And I was part of a session, the American Medical Writers give some, nowadays, great sessions. They always used to be clinical writers and regulatory and all this kind of thing, but they are getting more used to what's called storytelling and patient education. And one of the teachers gave a class on true patient-oriented writing. And almost all the class was doctors, nurses, PhDs, etc. And me, I'm the lay language 20-year health writer, okay? And so she hands out a sheet of paper with a list of terms on it, like intravenous or adhere, things like that, and asks them to bring it down to the lowest level possible. And you should have seen the confusion. They don't know the word for adhere. And I said, how about...
Exactly. Yeah, you almost feel sorry for them because they can't remember what it's like to be a normal human. You know what I mean? It's hard for them.
Normal human.
Really.
Yeah, that's absolutely correct. They've been so scripted.
Exactly.
Yeah.
So
you
yes,
help